All right, hey everybody, welcome to America's Leading Experts. I'm here with Dr. Brandon Bupp of Advanced Health and Wellness Center. Dr. Bupp, I'm super excited to have you on. I was just reviewing all your videos and things that you're doing at your clinic. It's pretty amazing. And what I really appreciate about how you started off even introducing your center is just how you're bringing an integrated approach to get people the results that are most important to them and their whole families. And you said it's hard because you're trying to go above and beyond the typical traditional clinic or wellness center. And so today I just wanted to bring you on because I know you're doing some amazing things with stem cells. I know you're integrating functional medicine into your practice. And so I wanted more people to get to know who you are and what you do for them. So welcome to the show.
Awesome.
Yeah.
Yeah, thanks for having me, man. I mean, and just to kind of jump into it, like our purpose is to see people have a better life, a better quality of life. Every day the conversation is about how we can help people to get their body to work the way that they want it to, so they
Yeah.
can do the things that they want forever. And so many people, and in our healthcare culture has created this reactive, passive patient, man, and those people have big problems, and so we want to avoid that. We want to get people to just be able to live the quality of life that they desire to live. And I think your health is really the greatest either asset or liability that you have in terms of quality of life.
Yeah, so true. So you're located in, is it Wadsworth, Ohio?
Wadsworth, yep.
I just want to make sure I'm saying that right. And what would you say? I mean, the speed at which regenerative medicine is coming into play, and you just brought up passive, which I'm projecting that you're talking about people wait till like there's problems and then they go see their doctor. And with regenerative medicine, we can actually grow, we can age better and
Right.
feel better. Why don't you share with everybody what are some exciting things happening inside your clinic and what most people just aren't even aware that's available?
Sure. Well, I mean, so we see people that have, for example, knee pain, and they're not able to get in and out of their cars, they're not able to go up and down stairs. Maybe they're not playing pickleball and they love to play pickleball. I mean, I have a guy, not an old guy, he's in his mid 50s, I want to say,
Right.
loves to play pickleball. Doctor told him that he had a meniscal tear and that he needed to have surgery with it, and but the doctor said you got a lot of arthritis, so it's maybe not even likely to work. He's like, well, that doesn't sound good, and also I can't do anything for a certain amount of time. He was going to be laid up for a long time, and so we did our regenerative treatment with him. So we have kind of a proprietary joint rejuvenation program that our patients go through.
Love it.
They do the injection. He did Wharton's jelly, and then we'll talk probably about more of it. But went through the process, and he's back to playing and feeling good and enjoying the things that he wants to again. So that's something that's exciting. So that was a quick thing, kept him out of surgery. We have other people that, like a lady that I just saw today, she said, "Well, I know I have arthritis in my knee, but I don't want it to continue to get worse." So I'm like, well, that's cool. We got a plan for that. She also had some weakness in her legs and instability. And so if we can increase the strength, we use something called M-Sculpt Neo, which is a FDA cleared medical device to increase muscle development and
No
strength.
kidding. Yeah.
It's awesome. And so if she can do that, man, like she lowers her risk of falling, which actually lowers her risk of dying, and she's able to do the things that she wants. So there's a lot of exciting things happening right now in regenerative medicine.
Yeah, you just mentioned like two big belief systems in our society that you just shattered them. And I think number one is if I can't go do pickleball, and that's how I see my friends, especially as I'm getting older, that's my social circle. That's my
Yeah.
identity. That's what gets me rolling. And so pretty amazing. I've always said to people like carpenters when they see a nail and they got a hammer, they just gonna hit it no matter what it is because
Right.
that's the tool
Everything
that
looks like a nail.
everything looks like a nail. Thank you for finishing that. And surgeons look at in orthopedics, like not all of them, because I don't want to throw them on under the bus, but they're looking at, okay, well, when do you need surgery? They're not asking like, okay, what regenerative therapies are out there? And so That's one thing you just shattered. And then number two is we're told that you can't actually increase muscle as we age, that it's just going to naturally get worse. So that's pretty amazing as well. Well, why
Dude,
don't you?
all those
Yeah.
things, man, all those things are so not true. And the reason we know that they're not true is because we see the reverse of that on a daily basis.
Wow.
And so, and not just on a daily basis, but multiple times a day.
Yeah.
And you just have to find out that there's things other than medication and surgery.
Yeah.
They're available. And so we do these lectures every week, every couple weeks. And the reason why we do that is because people are just not exposed to what's available to them. It's a shame, but it's just not how the system works. So people have to understand that they have to be their own best health advocate. Your doctor is absolutely not giving you all the options that exist and that can help you. They're doing the thing that they do and the thing that exists in their system, and that's it.
Yeah. Which doesn't make them bad. It's just what they do.
It's just the
Is what
system.
they
It's
do.
not.
Yeah. Yeah, that's crazy. So you're doing free, you do free seminars for people. What's the topic of the seminar and like who attends?
Yeah, sure. So our we actually do something called our Advanced Joint Rejuvenation Program. And so people that come to that are people experiencing pain, but a lot of times it's not just that they're experiencing pain, they're looking for something new and different,
Right.
right? Or maybe their pain has gotten worse. It's very common that we'll talk to people they said, my doctor told me I'm not bad enough for a replacement yet. And so I'm just going to have to wait until I need a replacement or do cortisone until it gets bad enough to get a replacement. Or there's people that are looking at it and going, I don't want a replacement. There's got to be some other
Right.
way, or there's something other than just drugs and surgery. And a lot of times people, man, they will hear they've tried everything else. And fortunately for them, that's not true.
Yeah. So that's what people will say to you when they come to your seminar and they learn from
Sure.
you. What are the alternatives there? I know you brought up Wharton's jelly. Can you share with
Yeah.
us what that actually is? And
Yeah. So,
I wanted to ask you about stem cells as well. So
sure. Yeah. So Wharton's jelly, really the way that we describe it, I mean, Wharton's jelly is comes from an umbilical cord. It's packed with growth factors, amino acids, proteins, hyaluronic acid, what they call proteoaminoglycans, which is kind of a cartilage matrix, but then it also has high levels of mesenchymal stem cells present in the tissue. And so it creates this regenerative environment for the patient. So we're not growing new knees, right? But the person does have the ability to heal the damage that's present in the joint itself.
yeah. And now my
Not
under
only that, but it attracts the body's response to it as well. So it's not really just what's in the tissue, but it's how that triggers an immune response with the patient. And then if I could, we don't our kind of proprietary process is that we don't just rely on the injection, right? So we're also using other advanced technology to help people get the best result they can. So we use things like pulse electromagnetic field, class 4 laser, this an M-Sculpt Neo device, frequency specific microcurrent. So we have like I said, a program that we have put together over years
yeah.
that is not just one treatment, but a multitude of things. So we call that our joint rejuvenation program.
Yeah, I love that. And I want to ask you about each one of those in a moment. So what's great about that is that when people are hearing about things like Wharton's jelly or stem cells, and you're starting to compare, if I'm out there shopping right now and I'm
Sure.
like, okay, I got this place down the street and I could look at Dr. Bupp's clinic that's right here. What's the
Right.
difference? So let's just pretend hypothetically the injections are similar. What does separate it when you start talking about the shockwave therapy or is it PEMF, the pulse elect?
PEMF, yeah.
Yeah.
Shockwave is part of it too, yeah.
Yeah. How do those work? And like, why are those so great for healing and rejuvenation?
Well, first I want to back up
Yeah.
because the great thing about Wharton's jelly is that It comes from umbilical cords. They're undifferentiated. It's undifferentiated cells, undifferentiated tissue. So it has no antigens for the body to reject. Which is awesome, right?
Yeah.
So that we don't have to worry about the body accepting it or anything like that. It's just the tissue that doesn't have rejectable antigens. So the immune system doesn't have a rejection response. It's immature tissue, meaning it's brand new versus like people have stem cells within them, right? You can get stem cells from bone marrow. You have to drill into your bone marrow, but as you get older, you actually lose volume, concentration of stem cells in your bone marrow, and they've also been recycled. So their potency is not the same as it would be early in life. So total
And can I,
volume and potency.
yeah, can I regurgitate that for like my,
Yeah,
so pretty much like when I have 7 kids, when one of my kids scrapes their knee and they're younger, it's like
yeah,
healed by 5 p.m. I scrape my knee and I'm older, it takes me 3 days. And then as my dad was alive, like his wounds never, like it took him months and months and months. Is that just pure?
absolutely.
Yeah, is that a little bit of why?
That's really what it is. Yeah, but also your elasticity, so your collagen elasticity.
Yeah.
Like I watch my 5-year-old twist his ankle and I look at it, I'm like, or even better yet, my 2-year-old,
Yeah.
he falls and rolls and I'm like, holy crap, if that happened to me, I couldn't get up. He bounces up and because he has a different amount of elasticity and flexibility and things like that in his body. So yes, your healing potential is significantly greater. So it's a similar thing. And just back to that point, the tissue, like the people that are donating the tissue, they are fully screened. They have to apply to be able to be a donor, and they have to qualify for it. And so it's also they're coming from accredited hospitals to accredited tissue banks, so that people they have to meet all these qualifications just to be able to donate.
Yeah. Yeah, that's great. That's great. That's great. Okay, cool. So then let's talk about your other, like the PMF and why that works and all
Sure.
that other fun stuff.
Yeah. So actually, another thing that I think people should be aware of and
Yep.
should when they're considering like different things to do. One is like getting a full and complete evaluation by the medical staff and looking at imaging. And then also when they're doing the treatments, are they using image guidance to make sure that the treatment is as effective as it can be because it's right where it's supposed to be located. So like we use ultrasound guidance or even C-arm video fluoroscopy guidance to make sure that that's
Yeah.
done. So I think making sure that you're getting a full and complete evaluation, a lot of places don't do that. Making sure that the injection is being put exactly where it's supposed to be. And we know that from image guidance where the needle is seen on the image and going in directly into the tissue. And then also like what else happens when you go through this process. So is it just an injection and that's it? And then we'll see you again in 3 months, or are there multiple parts to it? So we do other things like PRP, post Wharton's jelly. PRP is your own blood, but it's concentrated, and then they use that concentrated platelet-rich plasma to enhance healing. So that happens about 2 or 3 weeks after. And then to get into the technology, so we're using, like I said, pulsed electromagnetic field, which increases the polarity of the cell, which means helps the ion gate channel. It's a fancy way of saying it gets nutrients into the cell and pushes the waste out. So it's kind of rejuvenating
Yeah.
the cell itself. It's
Yeah.
been FDA cleared since 1978 for different types
Wow.
of things.
Yeah.
We also use class 4 laser, which helps modulate inflammation. It's not necessarily reducing because we want some, right? But
Yeah.
we want to stimulate healing. We want to stimulate blood flow to the tissue. So it does that. And it also stimulates cellular activation or cellular regeneration. So we use the class 4 laser with it. And then something I'm really excited about is our newest device is called mSculpt Neo, which has FDA clearance for joint to help with joint problems, but joint pain and inflammation. but also strengthening and stabilizing. So that's kind of like first phase is we're trying to help from a pain standpoint, reduce inflammation. But a lot of our patients, man, they got to be able to they haven't been using their joints because they've been painful.
Yeah.
So they become if the Ed you've heard the use it or lose it principle,
Yeah. 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 Yeah.
right?
100%.
So they've not been using it, so they're losing strength. So them Sculpt Neo actually increases muscle strength. So I have FDA proof, white paper proof, that it increases strength by 50% and increases actually muscle growth, muscle development by 25% in just 4 treatments.
Wow. That's amazing.
Right.
So,
So we combo those things all together based on the patient's needs.
and the thing about pain is that pain halts, like when you say that you use it creates like you're afraid to do things or to, and so then you have atrophy, which means you lose muscle, and then
Correct.
you're more stagnant, which then only reinforces being more stagnant. And so
Right.
with your rejuvenation protocols, like you're kickstarting the body and the joints to say, hey, let's get moving again, even if it's just walking or just doing stuff so that I think you already brought up in the beginning of the call, isn't like the number one cause of death, like falls with people over a certain age.
Yeah.
So
Physical, yeah, physical related.
injuries, and then
Yeah.
so we want to keep that mobility. So I mean, this is pretty amazing. So before well, first of all, how long you been doing this, and tell us like a little bit about how you got into this.
Yeah, sure. So I mean, we've been doing this for it's been over 10 years now. So there's some new people in regenerative medicine. I feel like we're one of the older groups and we've learned a lot and we've advanced a lot in that time. But to be honest with you, man, and like, so 10 years ago, we were doing a lot of stuff with insurance. I really wasn't happy with the results that we were seeing.
Yep.
And like anything else, insurance decided that some of the things we were doing, they were just going to stop paying for. So like we used to do gel injections, which were not regenerative. We didn't see any of the things that we see now, any of the results that we see now with it. But anyways, it was one of the better things. And then insurance like cut it and changed it and made it worse. And so we had to find some new things. And so regenerative medicine was really the thing. And to be honest with you, man, I believe that God directs our steps.
Yeah.
And so I feel like that was God introduced us to this whole regenerative medicine process because I mean over that time like I still see a lot of people that we saw 10 years ago and they still haven't had a joint replacement when they were told they would need one
Yeah.
at that
That's
moment.
yeah, that's amazing.
So it's been awesome.
Yeah, that's great. And you were mentioning your kids. How many kids you got and ages? Just out of
I
curiosity.
have four. I have
Yeah.
four.
Yeah.
So I have a five-year old and 2-year old. So far, they haven't needed any of the regenerative medicine stuff that we use.
Yeah.
But I also have a 16-year-old daughter and a 15-year-old son. They're pretty active with sports and different
Love
things.
it.
And from time to time, they'll do some of the stuff that we do in our office as well.
Yeah. So it's like a full family wellness
It
center.
is, and my wife is our nutritionist. So,
Amazing. Well,
right.
talk about that a little bit because I do see on your website you guys do have a weight loss program.
Yeah. Yeah.
Do you mind sharing just we have a few more minutes, so just yeah, let's do a
Yeah.
little pitch for your wife here and let's
Yeah,
get
so I'll give you like kind of the idea with our center. So we have a wellness center, an integrated wellness center. So we do regenerative medicine. We also do functional medicine. So meaning we look at blood work in detail. So Leah, our physician assistant, is highly trained in functional medicine. And so we look at blood work and we find out where there's deficiencies or where things, systems maybe are not working as well, or maybe why somebody has inflammation. We look at hormones. Hormone balance is really important to be able to heal and also to live a happy life. If you know men or women that their hormones are bad, men they can be miserable. And then we also pair that with nutrition and real. So my wife has a degree in nutrition from Bowling Green University, and so we're pairing that with functional medicine nutrition, which means how can somebody really eat healthy, eat in a way that helps to lower inflammation but supports the body's ability to heal If you're not,
Yeah.
we've all heard if you're not fueling your body, it can't operate at its best. But a lot of people are fueling it with things they think are good, but that's causing inflammation. So, anyways, step one is we look at detailed blood work, and then we can tailor a specific program for people. So we use things like our well nutrition program, but our red light bed. There's prescription supplements that we do. We do exercise prescription based guided exercise here. And then the other thing that the M Sculpt does is it has been shown to permanently kill 30% fat in 4 treatments.
Oh,
So it's
wow.
awesome. It heats up the fat to a point where it dies.
They're
Your
right.
lymphatic system gets rid of it. So they have FDA clearance to say that, and it actually also gets rid of 19% visceral fat, which is unheard of. That's the fat around your organs.
Yeah.
And so again, getting rid of that significantly lowers inflammation and helps those organs to work better. So all really fun stuff, man. We love all of it.
Yeah, this is outstanding. We're gonna have to get your wife on one of our calls because we could
He's way more popular than me. That's
uh
for sure.
all of our wives should be, right? That's great.
Right.
That's great. Okay, cool. So I want you to tell our audience two things. One is where can they come in for a free consultation or find more to at least call your clinic and
Yeah.
explore how they could get results. And then the second part is just if they were going to go, and I'm sure it might be the same.
Actually, hold on. Hold on. Let me just do this real quick.
Yeah. All right. There we go.
Come here. We were just talking about you.
There she is.
There
Ladies
she
and
is.
gentlemen, the real expert in the clinic just showed up. There
Somewhere
we go.
on this interview,
How's it
we're
going?
just talking about
Great,
our my
great. We were
wife, our
just bragging about
nutritionist.
you.
Would you like to say anything
About what?
in general?
Hi.
We were talking about, well, I'll set you up better than that. We were just because you are live, right? You're live right now. You are on the show, and we were
Right.
talking about how you're transforming people's lives through nutrition and hormones and all the amazing integrative things you're doing at the clinic.
Yeah, sounds
Okay,
great.
sounds great. So come, let's
Yes,
come
nice
in
to meet
here.
you.
Yeah. Have a
We'll
great
prepare you
day.
next time.
Yeah.
Yeah, it looks great. You can tell you're not in Tampa because when I interviewed our other doctor, he was in Tampa. Everyone's smiling. It's sunny in there. And you're dressed like we are. You're dressed like we are, like in Chicago, where it's like 1 degrees outside. And so, anyhow,
He was just showing up for our workout.
I love it. I love
We
it.
that's the other thing. We kind of live and breathe all the things that we do with people, which isn't always true with doctors.
Yeah, I love it. Well, you can tell. So,
So
yeah,
the
tell us
way that
about how
people
they
can
can
get a
get a
hold
hold
of
of you.
us,
Yeah,
yeah, so probably the easiest way really is to call the office. So our office number, contact information is 330-336-9500.
yeah,
Or you can go to our Facebook page, which is Advanced Health and Wellness Center.
right.
You search for it. We're in Wadsworth, again, Wadsworth, Ohio. We're right next door to Bueller's. It's very easy to get to, right in kind of right off the freeway. And if you have any issues or anything like that, you can call the office and we can help you.
That's amazing. And then also, could they find out about when your next upcoming free seminar is as well if they call the office or?
Yeah, that absolutely. You can call the office. It'll be posted on our website, which our website, you can also schedule through our website as well. So it's ADV. So
Yeah.
that's Alpha David Victor health.com. And so our lectures are posted there. All you have to do is send us a message and or call the office and we can get you registered for the seminars that way as well.
Yeah, I love it, man. I love what you're doing. You're leading from the front, and it's amazing how, first of all, regenerative medicine is so far ahead of what mainstream's even reporting. So I just want to
Yeah,
encourage you,
absolutely.
if you're out there and you feel off or that could be hormonal, you want to lose weight. That's obviously they have solutions there as well. But also like if you're in pain, there's inflammation in your body, you're having trouble sleeping at night, you're not able to do the things you used to do, then it cannot hurt for you to look at the solutions that Dr. Bupp and his team have for you. And
Right.
it's pretty
Well, and
amazing.
the truth is, Ed,
Yeah.
we if we can help somebody, then we will. And if we can't help them, then we'll send them to somebody that can. Because really should be lived feeling good.
Yep.
And there are so many more solutions than people even are aware of. We just have to get exposed to them. Number one, really do a detailed evaluation and then find out what those potential solutions are.
Fantastic. Well, hey, it's been great having you on. I love what you're doing. I might have to come to Wadsworth, Ohio myself and experience the love there. And it's amazing.
Yeah,
So
we'd love to have you.
yeah, we might, I'll bring the whole family. It'd be amazing. You guys won't know.
That's right.
Like, it'd be great. So, all right. Thanks, Dr. Bupp. Thanks, everybody. And we hope to see you on the next episode of America's Leading Experts.
Thank you.